The main risk factors for bowel cancer can be divided up into genetic, environmental, and pre-existing medical problems. When we talk about the genetic risk, this is really a family history. If a close family member, such as a parent or a sibling, has been troubled with bowel cancer, particularly if they were young when they were diagnosed, this can put other family members at risk, and this detail should be spoken about with a gastroenterologist who can advise as to any necessary steps to reduce the risk of cancer. The second risk factor is environmental factors, and this is predominantly our diet and lifestyle. If an individual has ulcerative colitis or Crohn's disease, they are at a slight increased risk of developing bowel cancer, and there are steps that will be put in place by their gastroenterologist to prevent this. Bowel cancer can present with a number of symptoms, some of which can be quite vague, and it's possible to mistake these with other medical conditions. The symptoms that always cause concern and should be investigated further are a change in bowel habit from the normal pattern, particularly if there are more frequent trips to the bathroom. Any abdominal symptoms that are new and sustained, these should always be discussed initially with the GP and then possibly with a gastroenterologist to discuss further investigation. Bowel cancer is a preventable cancer because most of the time it develops from precancerous benign growths called polyps. And polyps can be very easily identified and removed from the colon, thus preventing a cancer from forming. The factors that have been shown to reduce the risk of polyps and therefore reduce the risk of cancers are the sorts of things we should all be following anyway for our health. Maintaining ideal body weight is important, regular physical exercise, eating a diet that contains 5 portions a day of fresh fruit and vegetables, not too much by way of processed meat, and eating oily fish once to twice per week have all been shown to reduce the risk of polyps and cancer. Likewise, not smoking and drinking alcohol within the guidelines have been shown to be important factors. There is a national bowel cancer screening program. At present, at the age of 55, individuals are invited to take part in this with a flexible sigmoidoscopy. This is an endoscopy examination which examines the lower bowel. From the age of 60 to 75, individuals are invited every 2 years to provide a stool test for what is called a fecal occult blood test. This test detects if there are any trace amounts of blood in the stool that are not visible to the naked eye.